M2SYS Healthcare Solutions welcomes you to our latest podcast installment where we interview healthcare industry professionals for information, analysis, and opinions on the biggest issues that face the industry. Our latest podcast closely examines the topic of medical identity theft and how it affects patients, providers, and the healthcare industry. We are pleased at the opportunity to interview Jim Quiggle from the Coalition Against Insurance Fraud to discuss the causes and repercussions of medical identity theft, including what can be done to prevent it and what steps patients and doctors can immediately take after discovering they have been victims. Medical identity theft occurs when someone uses a person's name and sometimes other parts of their identity, such as insurance information, without the person's knowledge or consent to obtain medical services or goods, or uses the person's identity information to make false claims for medical services or goods. Medical identity theft frequently results in the creation of duplicate medical records and overlays, which include erroneous entries being put into existing medical records and can involve the creation of fictitious medical records in the victim's name. Medical identity theft is a crime that can cause great harm to its victims and directly jeopardizes patient safety. Yet despite the profound risk it carries, it is the least studied and most poorly documented of the cluster of identity theft crimes. It is also the most difficult to fix after the fact because victims have limited rights and recourses. Medical identity theft typically leaves a trail of falsified information in medical records that can plague victims' medical and financial lives for years. The following podcast is a recording of our conversation with Jim Quiggle from the Coalition Against Insurance Fraud discussing medical identity theft. Welcome to the next installment in our series of podcasts examining some of the major issues that affect healthcare patients and providers. My name is John Trader, and I am the Public Relations and Marketing Manager for M2SYS Technology, a biometrics research and development company based in Atlanta, Georgia. Today, our guest is James Quiggle, Director of Communications with the Coalition Against Insurance Fraud, which is America's only anti-fraud alliance speaking for consumers, insurance companies, government agencies, and others. Through their unique work, the Coalition Against Insurance Fraud empowers customers to fight back, helps fraud fighters better detect this crime, and deters more people from committing fraud. The Coalition for Insurance Fraud supports this mission with a large and continually expanding armory of practical tools which include information, research and data, services, and insight as a leading voice of the anti-fraud community. The Coalition has become one of America's most trusted and credible anti-fraud forces thanks to their remarkable diversity. Together, their members are working to control everyone's insurance costs, protecting the public's safety, and bringing this horrible crime to its knees. Since its founding in 1993, the Coalition has worked effectively to enact tough new anti-fraud laws and regulations, educate the public in how to fight back, and conduct objective and useful research on fraud, and bring together people and organizations in coalitions and alliances to work on specific areas of insurance fraud. The Coalition for Insurance Fraud's website is www.insurancefraud.org. James Quiggle is the Coalition's Director of Communications. A 20-year veteran of public relations and journalism, Jim joined the Coalition staff in March of 2000. He's busy stirring public outrage and stoking consumer support with outreach campaigns that tell the tale of fraud, wag the tail of reform, and unite society to combat this crime. He oversees the Coalition's outreach strategy, positioning the Coalition as one of America's most trusted authorities on insurance fraud. He has headed public relations for two major national trade associations, the National Association of Professional Insurance Agents and the American Society of Civil Engineers. Most recently, he was a public relations consultant and business journalist specializing in high-tech, banking, trucking, youth services, and other industries. Jim also was an editor and reporter for a small-town daily newspaper, manager of communications for a Washington think tank covering the media's reporting of business, and lead writer for a public relations firm promoting prominent national sports events. He's been published in news outlets such as the Washington Post, Miami Herald, Chicago Sun-Times, Reno Gazette-Journal, Virginia Business, and others. Jim also has won several public relations awards. He received a degree in psychology from Dickinson College. Jim, I want to welcome you to the podcast and thank you for lending us our time today.
John, thanks very much. I'm very glad to be here.
Great. Let's talk a little bit about U.S. healthcare. Total healthcare spending in the U.S. is the highest of any other country in the world, and recent figures estimate that approximately 17.3% of GDP is spent on healthcare, and medical costs are rising much faster than wages or inflation. The topic of medical identity theft in particular is becoming a concern of epidemic proportions for patients, healthcare providers, and healthcare plans. Not only is the federal government cracking down on fraud, but healthcare providers are striving to implement policies, procedures, and technologies that will help them minimize the risk of data exposure. There are actually many different forms of identity theft. Medical identity theft in particular is one of the most damaging and potentially dangerous forms of identity theft and can be the most difficult to prevent or detect. Jim, can you please define what medical identity theft is, how much it costs the country each year, and how many people are affected by it?
John, absolutely. Medical identity theft is very simple. It's the theft of an individual's medical identifiers in order to obtain health coverage, medical care, medicines, hospital care, physical therapy, psychotherapy, and other medical things that they want. In addition, medical identity theft is the mass theft of patient identification that's used and traded on the black market by crooks who will use the lists stolen from providers to make huge numbers of damaging and fake medical claims against health insurance companies, as well as federal programs such as Medicare and Medicaid.
Thanks for that information, Jim. Our research also has shown that the average cost to restore a patient's identity after being victimized by identity theft is over $20,000, which I don't think most people understand. And I mean, that's a number that's higher than the average cost to feed a family of four for 1 year, or the cost of 1 year of in-state public university tuition. Does that number sound about right in terms of your experience and what you've seen people having to pay out of their own pockets to restore their identity after being victimized by medical identity theft?
John, that does sound about right in terms of the hours you expended, which is time equals money. In terms of the cost you may have to incur in terms of hiring legal care, search firms, and other tools that you need to make your good name whole again. I mean, the fact is, I'm going to back up here for a second. This crime is huge, and it's the fastest growing form of identity theft. 1.4 million Americans have been victimized by medical identity theft in just 2010 alone.
Wow.
And that amounted to a cost of $30.9 billion. So we're dealing with a big-time crime here that affects a lot of Americans. So you start multiplying the number of Americans who by 20,000, and you have a huge cost. The other thing to remember, too, is it takes about 2 years for a consumer to resolve her or her identity theft and make their good name whole. That's an awful lot of time.
Why such a long time, Jim? Why does it take what would seem like an inordinate amount of time to clear your name?
Well, you have to go through a lot of steps. First of all, you have to search your credit record and find out what's wrong with it and why. What are the things that have been done to blow your credit record? Then you have to go through a long process of assembling the evidence that you need to convince the credit services that your identity has in fact been stolen. And in addition, then you have to go back into your medical files and start making sure that medicine that's incompatible with you, or blood types and other things are not stuck in your files. Plus, you have to identify all the medical establishments that you may have been defrauded by and contact them and see if you can convince them to change the records.
Interesting, and that's actually a great segue into the second question that I wanted to ask you, and that is, Jim, what are the most serious consequences for a patient that's victimized by medical identity theft? What are some things that can happen?
Well, you can be hit hard in a number of ways as a consumer. First of all, your credit record can get shot to all pieces because the hospital bills that a crook is building up in your good name are not getting paid. So the bills are sent over to the credit reporting agencies, and guess what? You've got some bad bills on your record, which is going to shoot your credit record straight down. And guess what happens then? Maybe you can't get a mortgage, or you have to settle for a higher rate. Maybe you can't get a personal loan. Maybe you can't get a loan for your kid's education. A lot of things can happen if your credit record is shot down. You have to worry about your personal health also. If the crook's medicine that you may be allergic to is lodged in your records, and then let's say you get hauled into an emergency room, semi-conscious, and the medicine on your records happens to be something they need to work to give to you, you're not there to say, no, this is something I'm allergic to. Same thing with a blood type. If it's an allergic blood type and you're bleeding blood badly after a car crash, well, you've got a problem because bad blood is in your records and you're going to be given it and you may not be able to say no. Consider also, you have claims against your health policy. There's a good chance that the claims might be large enough to max out your policy limits. And where does that leave you without health coverage?
Thank you for that information, Jim. I feel that sometimes people don't understand what the consequences of being a victim of medical identity theft are, and those were some very good points. Thank you. Let's change gears for a moment and discuss who is actually affected by medical identity theft. When we think about medical identity theft, I think most often we think about the consequences for the patient first. But I think what most people don't realize is that patients aren't the only demographic that can be victimized by medical identity theft. In reality, there are actually two forms of medical identity theft: the kind that involves a patient's data being stolen, and the kind that involves the physician's professional identifiers or credentials being stolen. Jim, can you talk to us for a few minutes about what are the effects of medical identity theft on physicians?
Well, there's different consequences depending on the kind of theft. If a physician's own medical identity is stolen and used to make claims, such as against Medicare, which does happen often, then you've got a significant problem because your good name is being used to steal, and word gets out that you're involved with theft. You've got to worry about your reputation being compromised. You have to worry about potentially your clients leaving if you're involved in even though inaccurately in a health scam. You're going to find that you're going to have to spend a lot of time justifying that you're not that your name was misused by a crook. And just like a consumer has to spend a lot of time clearing up their name, the physician has to spend a lot of time out of their practice making sure that their record does not show that they have been involved in a fraudulent claim. The other part of medical identity theft is a data breach against your patient's data, your files. It's possible that a database technician could be bribed to go into your records and steal all your patient's information, sell it on the black market. Well, a lot of things kick in. You've got to spend a tremendous amount of time telling your patients and notifying them that there has been a data breach and their names may be compromised. You may have to deal with, investigations as to whether you're in compliance with HIPAA regulations and other federal regulations. Patients themselves, they might decide to sue you if they were seriously damaged and their identity was stolen on your watch as a physician. A lot of bad things can happen, and none of them are good.
Very interesting. We actually read recently in an article that more than 5,300 physicians have listed themselves in a federal database that tracks medical identity theft. So the problem is obviously severe and growing. One other thing that at least our research has shown and that we've uncovered in terms of the effect of medical identity theft on patients, on physicians to their patients, is that patients have been reporting losing trust in their physicians after a medical identity theft has occurred. So in other words, if a patient finds out that their physician somehow subjected their medical record to a criminal, they may not be as willing to go back to that physician for either follow-up care or care for the rest of their family. And you and I both know that the healthcare industry is a very cutthroat industry in terms of competition to get patients, but also keep the patients for life. So I would think that patients reporting losing trust should be a serious concern for physicians that are victims of medical identity theft as well.
Well, John, I think you're right on target there. Reputational damage is one of the largest impacts on physicians of a data breach. You've got to go out there and tell all your patients that you didn't have enough security in place to protect their most sensitive personal medical information. Now their medical information is out there, possibly in the hands of a crooks, and you've got to tell your patients that. Gee, that's not going to make you look very good. And it may be a shame. You may have done your very best, but are patients going to listen to that? All they know is bottom line, zero-sum game. Their information was stolen on your watch, and that just doesn't look good. The potential to lose clients and possibly face lawsuits if, in fact, damage occurs to that client is not insignificant.
That's great information. Thank you, Jim. You actually alluded to medical data breaches a few minutes ago. Let's talk about them just for a minute. They're actually a growing phenomenon and becoming more widespread throughout the industry. In fact, in 2012 alone, just the top 10 healthcare data breaches exposed over 1.8 million health records. And the Utah Department of Health breach in March of last year led the list with over 780,000 health records stolen. It seems like healthcare facilities have a responsibility to protect patient data and data breaches that lead to cases of medical identity theft, and which continues to be a problem for healthcare facilities. Jim, can you tell us, if a healthcare facility is subjected to a data breach, what responsibilities do they have to their patients when victimized?
Well, John, let me back up one sec just to amplify the issue that you've raised, because it's a very, I think, a critical one. The research now does show that only about 40% of medical providers have confidence that they can prevent or quickly detect patient data loss or patient theft. And the second thing to be aware of is the average cost for an organization is about $2.4 million over 2 years to clean up a data breach. So we're talking significant time, reputational damage, money, and other costs in terms of getting yourself whole if you've been breached. Mm-hmm. Now, back to your question, John. Would you repeat the question?
Sure. Excuse me. I'm just looking for some feedback.
I just thought it was important to get that. I thought it was important to get that data into play.
Yeah, absolutely. Just looking for some feedback. If a healthcare facility is subjected to a data breach, what responsibilities do they have to their patients when they're victimized?
The first thing you need to do, John, is you need to notify your patients. You need to do it very quickly. There's no choice in the matter there. The second thing you need to do is review all of your procedures and make sure and find out what went wrong, how it went wrong, what you need to do to correct it. And that could be a very substantial issue because you don't know whether it was an insider job or whether you were hacked, and that potentially could make a lot of time. You also have to do a HIPAA review and make sure that you're in compliance with all HIPAA rules and other federal rules. That could cost you quite a bit of time and money, but you have to do it. And another challenge is you may have to correct a lot of patient records farther down the line if claims are made against their records that are on your files.
Jim, I would venture to say that it's also critically important for a healthcare organization to be completely transparent in the wake of a data breach and be as upfront and honest to their patients about the consequences of that breach, what types of proactive steps are being taken to prevent future breaches, and how patients can act on their own to protect their own medical data. Just kind of a summary of what you pointed out there. I think with the advent of social media, a lot of healthcare consumers or patients have new forms of communication that they can get the message out about their unhappiness with either a healthcare facility or a particular physician's office. So I think that healthcare organizations have to be very careful about reporting these data breaches, and as you pointed out, immediately report them and be as upfront as possible because of what we talked about earlier, the possibility of losing trust in the patient. So the social media really has, I think, projected or amplified the need for healthcare organizations to be as transparent as possible.
Well, that's a very excellent point, John. The fact is that everyone suddenly becomes a journalist when it comes to social media, and everyone has an opinion, and so they're going to be out there, and your name could be put into the ether and spread very quickly, very virally, if enough people start discovering that their identities have been breached, which they will when they're notified. So all the more important to make sure that as a physician you're taking proactive steps. What training are you giving to your employees under HIPAA compliance rules to make sure that they're aware of the warning signs of a data breach and that they're what you're going to protect? What are your systems in place, your IT systems, doing to, how are you safeguarding your systems against it? How are you making sure that your employees have only the data the information that they need to do their jobs? What we're finding is that often in smaller medical facilities, it's the insider jobs, the employees with vast access to patient data, more than they need to do their jobs correctly, often are the ones that are stealing your records. So that's very, very important to make sure that employees have only the data they need to do the job well. And the other thing is you have a lot of people who come into your office, and they're going to try to look over people's shoulders or look onto the screens and see if they can steal patients' information just visually. I mean, I've gone into my own doctor's offices and found that the screens have been practically turned over right in front of anyone who wants to look. And I'm saying, wait a minute here, that's my identity there. Right, could be looking over my shoulder and taking this down.
That's a great point. I think protection of data in a physician's office is certainly something that the healthcare industry is looking a little more closely into, especially in the wake of a lot of these recent breaches affecting really every type of healthcare organization that there is.
Well, if you don't, then you're looking at potential violations of HIPAA privacy rules. You simply have to take proactive steps to try to head these things off because you know there's a possibility that it could happen. Absolutely. Hackers are getting good, and insider jobs are also a constant concern.
It would seem that in cases of medical identity theft, that insurance companies will be well served with access to a concrete audit trail in place to help refute any false patient claims, trace a healthcare visit, and basically get a clear picture of medical history. Along these lines, Jim, do insurance companies see value in having some sort of an audit trail with a unique patient identifier like a biometric? And would insurance companies be willing to share in the cost of something like that with the hospital?
I'll give you a partial answer, John.
Okay.
No, insurance companies definitely see a value to an audit trail because this helps them create a much clearer record of what happened and how to trace back all the elements and steps of a crime. This also has a lot of legal implications, too, that can help protect an insurance company and show that it has taken all the legal steps required under federal rules to comply with privacy and pritection. Now, biometrics are a growing field. It's not just something that insurers are involved with. Hospitals and other medical providers are beginning to experiment increasingly with biometrics. I think this is one of the really interesting issues of patient protection coming down the road. There's a lot of new technology. Iris scanning, is being experimented with, for example. And so you can create what amounts to a visual fingerprint. Palm scanning, because the veins of your palm and the lines in your palm create a very unique record. And of course, there's good old-fashioned fingerprinting. And down the road, I can see a much wider use of smart cards that contain a load of patient identification that would make it very hard for a stranger to walk in with that card and be able to use it effectively.
Okay, great. Thank you for the feedback on that question. Let's talk for a minute about the Affordable Care Act, which was signed into law in March of 2010, but I don't feel that until recently we've kind of understood the full impact that this legislation could potentially have on the healthcare industry. Within the provisions of that act, there's a section that mandates all uninsured in the U.S. purchase some form of medical insurance through what are called health insurance exchanges, which are basically a set of government-regulated and standardized healthcare plans in the U.S. from which individuals may purchase health insurance eligible for federal subsidies. Jim, with the influx of new healthcare patients due to the implementation of the Affordable Care Act, what impact do you expect this may have on medical identity theft and insurance fraud?
Well, there's a lot of potential ramifications. Hackers are going to go after that data. There's going to be a tremendous influx of data into the medical providers that are involved with the exchanges. And that data is going to be very valuable. If you get a name that's worth $50 or more on the market compared to about $1 or so for a social security number. So this is gold, and the crooks are going to be going after the gold. The pressure is going to be on providers to make sure that their systems are armor-plated with titanium against fraud, especially insurance companies. They're going to be challenged to create robust systems that are flexible, that can identify cons as they're foisted, rather than looking in the rearview mirror afterwards. This is going to be the job of predictive analysis and other forms of far advanced technology. So the danger is going to be there. The other problem too is that not all organizations are going to be fully, solely operating in exchanges. You can also operate outside of an exchange. And, people can buy insurance outside of an exchange. There's a price to be paid, but you can do it. So what does that mean? Well, you have freestanding insurers just like we do now, who still might be susceptible to fraud, and you have consumers who might be susceptible to fraud, whether inside or outside of an exchange. So it's still going to be a Wild West to some degree, especially when it comes to cyber attacks aimed at extracting data in high volume from exchange members.
Okay, that's great information. Thank you for the feedback on that. Let's talk for a second about victims of medical identity theft and what some telltale signs are that a person might be a victim. Because I think patients may be for an extended period of time not even aware that they're victims of medical identity theft. Can you share with us some of what those telltale signs are that you have been a victim of medical identity theft, and what steps patients can actually take to prevent medical identity theft in the future?
Yes, John, excellent question. John, there are many telltale signs that your identity may have been stolen. One of the first and most obvious is when you get your statements from your insurance company and you start seeing bills for procedures on days that you were vacationing in Hawaii, and these are for operations. You could be, that's a huge sign. I mean, I've seen one case where an individual received a bill for a leg amputation, for another person. And the person took that bill into the medical facility and showed it in front of them on two good legs and said, hey, I can assure you this was not my leg operation. So you need to watch your bills. You need to look out for your medical statements closely. The second thing you need to be aware of and worry about is if you start finding that your insurance bills are going up, like your auto insurance, or that you're not getting loans, mortgages, personal loans, educational loans, or that your rates are getting high, you're going to find this out during the loan process because your credit history is going to come up. And you're going to find that you've been dinged pretty significantly. And you're going to wonder why that happened because you've been paying all your bills regularly. Then you have to go back to your your credit provider, and you're going to find to your horror that there's a load of unpaid hospital bills in your name that are being used to lower your credit rating. Not a good thing.
You mentioned earlier medical statements, Jim. Are you referring to things like explanation of benefits and how important it is for patients to read thoroughly each of those documents after they've gone for either a hospital visit or a visit to a physician's office? Is that what you're referring to, the explanation of benefits?
Yes, I am, John. These bills come out monthly, and they're often very hard to read, and they're not graphically easy to read. And so it's easy to kind of dismiss them or toss them aside because you say, oh, well, I haven't been to had any treatment lately, so I don't have to worry about it. You toss it into the trash can, and you don't even like reading it to begin with. Mm-hmm. You should check very closely every month to make sure that your hospital bills reflect all the treatment that you have incurred during the last month. Failure to do so could result in your credit taking a big whack.
You know, that's a great point, and I really feel sometimes that a lot of the problems that stem from medical identity theft, how to prevent it, steps to take if you're a victim of it, have to do with education. And I just from my own reading on the topic, I've seen that there are a lot of healthcare providers that do a great job in educating patients about how to protect themselves again, how to look for telltale signs that you discussed. For example, I saw a recent report that was done by the Ponemon Institute, and some of these numbers that they published about medical ID theft are alarming. Only 15% of the 800 or so people they surveyed were familiar with the term medical identity theft. 15% are actually able to define what it is of those that were familiar with the term. 19% of the people that were surveyed think it would take less than 2 weeks to correct their medical ID if stolen. And you mentioned 2 years is usually the average, so there's obviously a huge disconnect there. 22% believe that the most likely consequence of medical ID theft is their insurance will be canceled. As we know from our discussion with you, that's just the tip of the iceberg. 24% of the people surveyed have checked their medical records for fraud, which I think is a really low number. 32% think it's likely that their medical identification will be stolen, and 56% think it's likely their credit card or their credit card number will be stolen. So just from reading off those numbers and briefly discussing about education, it seems like the industry has quite a ways to go in terms of making this a top-of-the-mind thing and educating people on how to prevent it and detect it.
John, you're 100% on target. People tend to be very passive about this crime because it's abstract. They don't quite get it. They don't understand what it is fully, and so people tend to dismiss what they don't really understand. This is why the healthcare industry at all levels, insurance companies, individual providers such as physicians and others, really need to take the lead in educating consumers to how to play their role in heading off medical scams, what to do if a ID theft has been discovered, and to help them understand their stake in this crime if it's made against them. Providers, physicians especially, because they have good relationships, in very many cases close relationships with their clients, their patients, I think they're in a perfect position to provide material to their patients on medical identity theft, actually to be the tip of the spear in terms of letting people know that this is a crime that they need to play a role in taking care of.
Absolutely. And just kind of recapping a little bit of what you talked about earlier, we discussed the fact that hypothetically, if you are a victim of medical identity theft, it's very critical that you act swiftly and deliberately to fix the issue. Let me throw this question at you, Jim. If you do find out that you are a victim of medical identity theft, and I know you've covered a little bit of this in our prior conversation, but maybe you can just kind of reiterate what steps you can take to immediately address the problem if you somehow discover that you've been a victim.
This is as a consumer.
Yes. As a consumer.
If you discovered you've been a victim, you have to move fast, you have to move quickly, because the damage to your credit, the damage to you financially is going to continue, because crooks are going to continue to mine your identity for more and more claims, unless you put a stop to it immediately. If you've been a victim, go to the police, let them know, so there's a record on that this crime has happened that can start an investigation. Second, check the credit rating services and find out if your credit has been compromised. Then work with them to provide the evidence that they need to help clear your record. You also need to go to your medical providers, especially your primary, who will be the first person to correct your identity. But then you have to identify all the others and make sure that your medical records are cleared, that there's no funny business, no false claims, no medicine, no blood types, and other disruptive information that could soil your record and possibly expose you to physical and medical harm.
Yeah, absolutely. Those are great steps. I didn't even think about alerting the police. That's so key, because they really need to develop some sort of a record of you being victimized, but also look for patterns. I think that's kind of what they look at, because you and I both know that it's very, very difficult to catch the perpetrators when it comes to medical identity theft. But if somehow law enforcement can identify and understand patterns, perhaps they could more easily identify those that might be responsible. So that's something I didn't even think of. That's a great point. For more information on consumer medical identity theft, tips on how to prevent it, and corrective measures to take in the event that you are a victim, please visit the Coalition for Insurance Fraud's website at www.insurancefraud.org. You can give them a call at 202-393-7330 or drop them an email at info@insurancefraud.org. You can also go to the Federal Trade Commission's website at ftc.gov/ID theft for more information on medical identity theft. I'd like to take a moment and thank Jim for his time, his wisdom, and his insight into medical identity theft, and for all of the helpful information that he shared with us today. Thank you very much, Jim.
And thank you to John. It's been a pleasure talking with you.